Muy buenos días, colegas. Bon dia. Good morning, everyone. Quisiera darle la
Good
bienvenida.
morning, colleagues. Welcome to everyone to this event. This is a high-level event on the part of PAHO. We are ready for our event entitled Opportunities and Challenges Towards the Elimination of Tuberculosis in the Americas. We have simultaneous interpretation into English, Spanish, and Portuguese, and you can choose the language of your choice by using the globe icon at the bottom of your screen.
Portuguese, and at the bottom of your screen, you will see a globe, and you click on the interpretation globe, you can select the language of your choice. Soy Pedro Abedillo, asesor regional de tuberculosis de la Organización Panamericana de la Salud en la oficina de Washington, y voy a ser...
My name is Pedro Abedillo. I am the advisor for tuberculosis prevention, control, and elimination, PAHO WHO. As you know, we are celebrating World Tuberculosis Day. This is a day that helps us remember all of the people affected by this disease. Here we discuss that disease, we look at reflecting on the progress being made, and another thing that the day does is mobilize our commitment for high-level action so as to fund these operations, to continue with our ambitious plans to put an end to tuberculosis. As we're going to be seeing during the event, we face many challenges in the region as we respond to tuberculosis. The region is still recovering from the impact, from the after effects of the COVID pandemic, and the tuberculosis programs were seriously affected during the COVID crisis. However, we have a firm commitment entered into by world leaders that can continue to accelerate this response, but also we have available to us new technologies, new strategies, innovative interventions that allow us to approach our ideal of eliminating tuberculosis. And again, this year, the slogan is yes, yes, we can eliminate TB. And what this message does is convey a message of hope. We feel that this is possible, and this is an appeal so that we can bring an end to tuberculosis, so that this year we can deliver on our commitment. And this is the objective of today's event. We want to commit high-level leaders to take action by investing resources to assure universal access, especially focusing on populations in a situation of vulnerability. And today we have high-level guests. They're going to be sharing their vision with us, examples of best practices, and this will allow us to accelerate our progress towards the elimination of tuberculosis in the region. Today's agenda is led by Dr. Jarbas Barbosa, who is the director of the Pan American Health Organization. Also, we have Dr. Monica Alonso, who is unit chief of HIV and viral hepatitis in Washington. And also, we have high-ranking health authorities from two countries in the region, Dr. Ethel Maciel, who is Secretary of Health Surveillance and Environmental Health at the Ministry of Health in Brazil, and Dr. Eric Ricardo Peña Sanchez, who is Vice Minister of Public Health in the Ministry of Health in Peru. Also, we're going to be hearing from Karen Rivas, who is representative of civil society in Colombia in their fight against tuberculosis. And also we will have closing remarks given to us by our Assistant Director of PAHO, Dr. Rhonda Seeley-Thomas. So with no further ado, first I want to thank the audience for joining us today. And now I call on our director, Dr. Barbosa, for him to give us some opening remarks as we start this celebration of TB Day. Dr. Barbosa, please go ahead.
My dear friend, Thelma Fiel.
No lo oímos, doctor.
Un momento.
Ahora sí, creo que sí.
Sí.
Ahora sí.
Thank you, Pedro. Buenos dias, good morning. My dear friend, Thelma Fiel, Secretary of Environment and Health Surveillance. the Minister of Health of Brazil, Dr. Eric Ricardo Peña Sanchez, Vice Minister of Public Health, Minister of Health Peru, Mrs. Karen Rivas, Colombia Anti-Tuberculosis League, the Antioquia section, our Assistant Director, Dr. Rhonda Philly Thomas, esteemed participants and colleagues. It is my pleasure to welcome you to this high-level event to discuss opportunities and challenges towards the elimination of tuberculosis in the Americas. Each year, we recognize World TB Day on the 24th of March, and this year's theme, Yes, We Can End TB, conveys a strong message of hope. Hope that it is possible to get back on track after the COVID-19 pandemic and to accelerate the efforts to end the TB epidemic through high-level leadership, increased investments, implementation of WHO-recommended evidence-based tools and innovations, and a multi-sectoral approach with meaningful community participation. In 2022, after 2 years of disruptions caused by the pandemic, we have seen a significant global recovery in TB diagnostic and treatment services. For example, in 2022, more than 240,000 people with TB had access to diagnosis and treatment in the Americas, which is the highest number in the past 2 decades. This is an encouraging trend that is beginning to reverse the negative effects of the interruptions in the TB response during the pandemic. This trend also reflects the significant effort being made by our countries. However, despite this progress, TB remains a significant cause of death in the region, and the global TB targets have not yet been fully met. The estimated incidence of TB and the estimated number of deaths associated with TB continue to rise. In 2022, there were an estimated 35,000 deaths from TB, making the Americas the only region where TB deaths is increasing. This trend reflects persistent challenges related to poverty and inequality in the region that exacerbate the disparity burden of TB in individuals and population groups in situations of vulnerability, as well as the inequitable access to health services. At the same time, we have an unprecedented opportunity to advance the agenda towards ending TB. In September 23, heads of state reaffirmed their commitment to end TB during the second United Nations high-level meeting on TB, resulting in a new political declaration with ambitious targets to be met by 2027. We must join forces to translate these political commitments into tangible and concrete actions and sustainable investments. The Pan American Health Organization is working with its member states to prioritize equity in the TB response and accelerate the implementation of innovative technologies focused on strengthening primary health care and identifying the barriers impeding vulnerable populations from having access to diagnosis and treatment. We are at a unique moment to make a paradigm shift in the TB response to stay one step ahead of the epidemic. To do so, we need to prioritize active case finding, not only for the disease, but also for TB infection among vulnerable and hard-to-reach populations. Currently, only 3 of 4 TB cases are diagnosed. Therefore, it is crucial that we implement the use of more sensitive tools for systematic screening, rapid molecular testing for diagnosis, and shorter treatment regimens. We also need to expand the TB preventive treatment. Shorter 4 and 12-week treatment regimens are available through PAHO's strategic fund. Still, currently less than 1/3 of individuals at risk of TB in the Americas have access to these preventive treatments. Permítanme continuar ahora en español. Es necesario aumentar el
Allow
financiamiento.
me to now speak Spanish. We have to increase financing for research and accelerate the availability of new medication, more sensitive tests, and work closer to the population and seek new vaccines against tuberculosis. There are still challenges to eliminate TB, and that is the social determinants of health, poverty, inequality, malnutrition, comorbidities, discrimination, and stigmatization are the main drivers behind this epidemic. Even though poverty rates improved in the region in 2022, that trend is not enough to turn around the negative effects of the pandemic, and 29% of the population still lives in a situation of poverty. That is why we need a multi-sectoral response, including active engagement of parliamentarians, civil society, academia, and the communities affected by the disease, so as to be able to put persons and their needs in the center of our response. The Pan American Health Organization is giving priority to implementing its initiative, its elimination initiative, which is a comprehensive approach to communicable diseases in the Americas, aiming at eliminating more than 30 communicable diseases and related conditions by 2030, including tuberculosis. That elimination initiative wants to change the paradigm of the traditional vertical approach to a disease program to a comprehensive model, emphasizing efficiency, quality, and equitable access to services, especially in terms of primary health care. The objective is to create resilient, effective, community and person-centered health systems with special attention given to vulnerable groups and the social determinants of health. It is urgent for us to adapt and innovate and come up with strategies that increase access to diagnosis and treatment for the most vulnerable groups. That is the people that live in poor communities or that live in far-to-reach communities. Also, we have people that live with HIV, people that live on our streets, etc. The acceleration of eliminating tuberculosis can benefit from a comprehensive and optimized approach. And in turn, the response to TB can also provide us with a sound platform to support the effort to eliminate other diseases, including HIV and NCDs. The region of the Americas have the opportunity of becoming the first region to eliminate tuberculosis worldwide. And here from Tahoe, we make an appeal to member states and all stakeholders to work together to accomplish this objective. And yes, we can end TB. Thank you.
Thank you very much, Director Dr. Barbosa, for your inspiring words and for setting the tone on the way forward. Very clear message on the actions that need to be implemented, optimizing the use of all these available tools and innovating the way they are used can significantly help us to speed up our efforts to eliminate tuberculosis. Thank you, Dr. Barbosa, for being here with us, and thank you also, Dr. Silly Thomas. Your presence in this event shows the commitment of the organization with TB elimination. Thank you. Our next speaker is Dr. Monica Alonso. She is the Unit Chief for HIV, STIs, viral hepatitis, and tuberculosis at PAHO in Washington. And Dr. Alonso will present the priorities for the Americas to accelerate progress towards TB elimination. Please, Dr. Alonso, the floor is yours.
Thank you, Pedro. I have a presentation. I will share my screen. Please confirm that you can see. I'm trying to put it in there in full. You can see and you can hear me. Okay, so thank you very much to the authorities and all the participants that are joining us in this event. Yo voy a hacer la presentación en español. Y en los próximos 10
And I
minutos
will be speaking Spanish. In the next 10 minutes, we're going to be talking about the priorities to eliminate tuberculosis in the Americas. And as Director Barbosa was saying, tuberculosis is part of the group of diseases and conditions associated with it that come under our initiative for eliminating communicable diseases here at the Pan American Health Organization. Here we can see two of the most important milestones in terms of eliminating TB. The estimated incidence of tuberculosis per every 100,000 inhabitants. And you can see that we are off track if we want to end tuberculosis by 2030. And we see something else that really catches our attention, and that is that the COVID pandemic really did mark a before and after in terms of our response to TB. Our region has been affected significantly, and this has affected both the incidence as well as the number of deaths. Both curves are going up. In other words, that is exactly the opposite of what we would want to see if we're going to end tuberculosis. The number of deaths because of tuberculosis has actually gone up more than in any other region of the world when compared to the previous year. So, as the director was saying, we have 325,000 people that contracted tuberculosis in 2022. 12,000 of these people had resistant TB, in other words, drug resistance, and that can vary between 1, 4, 8% in different countries. Those people with TB, 35,000 people died because of tuberculosis. That means that every day there are almost 900 cases of tuberculosis in the Americas, and 96 people die per day. Now, the region shows some diversity. You can see that there are some countries with a high burden, a burden that is above 100 per 100,000 cases. But then more than half of the countries in our region have a moderate incidence, 22 countries that represent 70% of the cases. And then a group of countries, 14, that are considered to be low incidence. In other words, 10 or less per 100,000. So with this overview, with this diversity, where we have countries with high, moderate, and low burden, we do believe that with the tools we're going to be discussing, we can make significant progress so as to help the region put an end to tuberculosis. As Director Barbosa underlined, governments worldwide and also the governments from our region renewed their commitment last year to put an end to TB. And here we have a set of goals to be able to accomplish elimination of TB. Now, where do we stand in the region? Out of those 325,000 people with tuberculosis, 240,000 were diagnosed. That means that we have 83,000 people with TB that were undiagnosed, and consequently, they were not treated. We know who these people are. For example, people that are deprived of liberty, people that are that cohabit with tuberculosis, other vulnerable populations, indigenous populations, our street people, etc. Also, we note that out of these new diagnoses, less than one half of the diagnosis had a rapid molecular test establishing that diagnosis. It's important to do these rapid molecular tests so that these people can quickly be put on treatment for tuberculosis, because that assures the success of the treatment and also it decreases transmission. However, of the people diagnosed with TB, 72% actually completed treatment successfully. If we put all of these numbers together, the numbers we're discussing, about 50% of the people with TB, that's the estimated cases in the region, did not receive treatment or they didn't successfully conclude treatment. Now, when I talk about treatment here on the left, we can see the different breakdown. We can see patients with TB, new cases, relapses, retreatment, tuberculosis, HIV, and success rates regarding treatment. And you can see that in those that are drug resistant, they have less success. So we need treatment to be successful so as to be able to prevent drug resistance. We don't want people to drop out of treatment or be lost to follow-up because that creates greater resistance and it also compromises future treatment successes. Here on the right, you can see how we stand. This spans the past decade. It shows us the success of treatment in the Americas. And what we can see is that we have not improved. Not only have we not improved, we are actually losing ground. And we blame COVID for that. But the truth is, this indicator has not improved because before COVID, we couldn't see an upward trend either. However, right now, we do have major opportunities. We have new oral treatments to treat drug-resistant tuberculosis, and we have 15 countries that are already implementing these different arrangements, BPALM, BPAL, for drug-resistant tuberculosis in the region. But we know that we have to have integrated services for comorbidities at the first level of care. So we have to work on these care models so as to produce a shift in this indicator of success of treatment, working with communities and using digital technologies, video, for example. And we have to insist on all of the aspects of social protection to make certain that these people are able to successfully conclude treatment so we can change these numbers regarding treatment and reduce mortality. Now, another very important aspect that we have touched upon is what is done with the vulnerable and most affected populations. And one of the new things being implemented in countries like Peru, Paraguay, Haiti, Colombia, just to mention a few, is this systematic screening using digital radiography supported by artificial intelligence and focusing on these populations. For example, we have results in the prison population, the trans population, hotspots, people with HIV, indigenous population, people living on the streets. They were screened and with positive results between 1 and 4.5%. Of those people screened, or 1 to 4.5% of these people had tuberculosis. And another number that's not on the slide is that about 1/2 of these people had no signs or symptoms of tuberculosis. Consequently, these innovations of digital radiography is essential so as to take that step forward in responding to tuberculosis. And if we talk of vulnerable populations, here we have these numbers in terms of reporting rates for TB of people deprived of liberty. Only 2 countries have values below, or an incidence below 100 per 100,000. All other countries, and remember, 100 per 100,000 was considered to be a high burden. But TB in prisons is a high burden level. Sometimes there are figures of up to 4,000 per 100,000. Also, it's important to use fast molecular testing for the diagnosis of tuberculosis and also to diagnose resistance. Here again, we have divergence across the region with countries that have made major strides in terms of implementation, above 90%, the initial diagnosis using rapid molecular testing, but there are still some countries that have 1/4 of the patients, 1/2 of the patients, or more perhaps, and they are not having that initial diagnosis using molecular testing. Remember, these innovations have been in place for more than a decade. Molecular rapid tests can also be implemented using molecular platforms that are multi-diagnosis.
So these molecular platforms capable of multiple diagnoses can be used in healthcare services overall. We also think that the low sensitivity, large coverage of low sensitivity tests, as you can see on the screen, limits the diagnosis of drug-resistant TB. Now, the last frontier is a preventive treatment of tuberculosis, and here we have a large debt. More than half of people with HIV and half of children under 5 years of age in contact with people with TB receive preventive treatment. Once again, this is a lost opportunity, but think that there are abbreviated or shortened schemes or approaches for TPT, a weekly 3-month regime that costs no more than $11.33. So we have 6 priorities for the elimination of TB. Digital X-ray screening, rapid molecular tests focused on hotspots and vulnerable populations using information systems that are patient-centered and electronic, enabling us to make quick decisions. And with this, we can do contact searches and use a shortened treating program with support in the community and social protection as necessary. Let's not overlook the multi-sectoral approach and civil society's support, and in the community, we need to avail ourselves of all available resources in countries in order for us to fight against and ultimately do away with TB. So the support of civil society, of the community, support for the community at all levels, advocacy, and planning and implementation, all of this is key. Lastly, I would be remiss if I were to mention or close without mentioning that we are very excited about a tuberculosis vaccine and new innovations coming down the pike, such as more sensitive skin tests that would enable us to progress in managing, prevention, and elimination of tuberculosis. Thank you very much. Thank you very much, Monica, for that presentation that enabled us to take a detailed look at what the opportunities are, challenges, as well as priorities in the region to eliminate tuberculosis and to get ahead of the pandemic, actively seeking out cases and preventive methods that will help us move more swiftly toward elimination. We know that countries of the region are making strides. Now we're going to hear some detailed examples in the region of experiences and innovations that will enable us to speed up this response. So I would like to invite Dr. Ethel Maciel, Secretary of Health Surveillance and Environment from the Health Ministry of Brazil, who will be sharing with us the tuberculosis elimination plan and other socially conditioned diseases in Brazil. Healthy Brazil United for Care is what it's titled. I thank you very much for being here. Dr. Ethel Maciel, you have the floor. Thank you.
I'm going to speak in Portuguese, and I'll be sharing my screen Please make sure you can see.
Perfecto, doctora. Está cargando en modo completo, porque ahora vemos las
Aguardamos, we're just waiting for the screen to be sharing.
Todavía no. Vemos las diapositivas, pero no en modo pantalla completa. Modo presentación.
We don't see it yet in presentation mode.
Ya una vez que la tiene abierta, puede seleccionar
Once you've opened it,
directamente la ventana.
So I'm struggling a bit with technology here because things seem to be looking okay at my end.
Perfecto. Gracias, doctora.
I will be talking about Brazilian experience with the Healthy Brazil program, which is bringing everybody together for best care. And what has been happening in Brazil over the last course of the few years? We have been able to maintain the same program that we started in 2021. We were able to cover 83% of the cases estimated by the WHO have placed us where we were pre-COVID. During COVID, of course, it was harder to pinpoint the cases. Here in Brazil, we are still consolidating data from 2023, and the data we have so far are from 2022. And as you can see, there was a very high number of deaths, which was the worst indicator over the last few years in Brazil. We had 5,845 deaths in 22, which over the last 20 years, it was the worst result. So it's a challenge for us to overcome that. As Dr. Monica has said, there is a very high concentration of vulnerable population in people who are HIV positive. Since 2018, they were not the first place of new cases, but now we see there's a higher percentage of people living with HIV. This is a source of concern for us. Over the last few years, the people who were in jail had a higher number of TB cases, and I would like to highlight also our census that was carried out with the WHO shows that 48% of the TB affected families were spending 78% of their 78% of the households were spending 20% of their income to try to treat the TB. Brazil expresses all of these results where the vulnerable population has a very high load of the disease, and we also understand that TB is making this vulnerable population even poorer. So with this vicious circle, we have to consider our commitment, and we would like to highlight how last year at the UN, we presented our plan for our interministerial commission, that is establishing the program I am going to cover now. Brazil is one of the only countries with a high load of the disease that has universal health care. So we have a whole line of care that is free for the people who have TB. So we are able to care for the people with our unified health care. We are making available the preventive treatment and also the health care, including other different types of actions like adverse side effects that are a result of the intake of medication. We also have, as I have mentioned, a sequence in our national plan for the TB control that since 2017, we have been meeting our goals so that we can get to 2030 with the indicators agreed with WHO that cover all of the steps, and our task is Herculean. We had over 5,000 deaths, and now we are aiming to get to 230 deaths by 2035. We hope then to get to less than 10 cases by 100,000 inhabitants. Nowadays, we have 37. So we have half of the people with TB that are going through this ordeal. We have to do a lot here in Brazil. Our new government that started their mandate in 2023 had to deal with the situation. In 2022, we had the higher number of deaths over the course of 20 years with a detection level that was below what we expected. And half of the people with TB are having catastrophic results. So within the scenario, we have developed a strategy that was to make our president, Lula, understand that the health care sector could not work on their own so that they could eliminate TB by 2030. So the president signs a presidential order, an executive order, bringing a lot of the other ministries together so that we can conceive different plans in order to intensify our work with people in prisons, the people who are living in the streets, people who are HIV positive, and those who need to be helped when they find themselves in extreme poverty, people who give up on their treatment because they don't have access to food. We know in Brazil that the fact that people can rely on receiving the basic needs and have the basic needs addressed, they are able to overcome TB. So we have to overcome issues that are not directly related to healthcare. So we created a program called CIEDDS, and we have a publication explaining how this interministerial group works. And with that, we have created in Brazil a program called Brasil Saudável, Healthy Brazil, working together for healthcare. That in addition to this interministerial group, other sectors started helping us towards the elimination of TB. So it's the first time that the federal government has a program to eliminate diseases. We have 10 diseases and 5 vertical conditions that are part of the federal government, and we hope that with the promotion of human rights and elimination of poverty and hunger, we can establish infrastructure and sanitation so that we can overcome the diseases. This program was launched here in Brazil in February 7th with Dr. Tedros and Dr. Jarbas, who were here with us. And what we were able to do now is working with the social development ministry so that we can increase social protection, so that people have access to food, transportation, vouchers, and programs that we have where we help families in need so that diseases that are part of this program will be prioritized in government policies in the Ministry of Social Development. Like that, we can also implement better technologies with portable X-ray, CAD, and other shorter treatments with medications that can help with the multi-resistant TB. So in 2023, we are finalizing all the public purchases and distribution so that we can work in order to target vulnerable populations, thus improving our regional capabilities. We have a program in Brazil that takes the healthcare professionals to cities that do not have the right kind of access to healthcare. So we have been hiring a lot, and healthcare professionals are sent to municipalities where they are able to work within the program that we have. To give you an example, last week, with our unified healthcare, we have a 3-part program with federal, state, and municipal governments that cover all the actions needed in the country. So last week, we were able to agree on a funding of 100 million reais for the elimination of TB. So this is 10 times the annual value and amount that the federal government gives to municipal government. So this year we have allocated over 100 million reais for these efforts. Last year, we gave 14 million reais for TB research so that we could work with control of the disease. In a partnership with Fiocruz, we were able to allocate 3 million reais for RNA vaccines in order to do the right research. Now we have a Fiocruz task force that is starting the first research. 4 million reais were allocated also to help with the social control of HIV and TB. And for the next year or this year, we have 1.5 million reais and 1 million for another research that will also be using media with social engagement objectives. So we are considering our opportunities and our work plan, which will consider research to better understand social vulnerability and how they can be overcome. Our political commitment in Brazil is very high, and the president himself is engaged in the creation of this program, expressing a high capability of planning and surveillance with all the openness, with all the work we're doing with states and municipalities, and we are galvanizing more investments using the 2024 resources. We're working with our parliament also so that we can have even more funding for 2025 by working with different ministries and have a better quality of analysis so that this population is better covered, where we have been seeing new cases and a new load. So I would like to say that we are able to get rid of TB, and we are committed with prevention, diagnosis, and
Thank you,
everything else.
Dr. Ethel, for your words, for all of the planning that is being done in Brazil, working in the communities, working with families, vulnerable populations, bringing together all the different sectors and ministers to overcome the difficulties and barriers. Were it not for that collaboration, these efforts would be for naught. Now, the priorities as set forth by Brazil are quite impressive. Working across different sectors and ministries is quite emblematic and a point of reference for the whole region. So thank you very much for your presentation. We have more than 600 participants listening in. Now I would like to welcome Dr. Peña Sanchez, Vice Minister of Public Health from the Ministry of Health of Peru, who is going to talk to us about Peru's experience, what innovations and progress it has made toward the elimination of tuberculosis. Dr. Peña, thank you very much for your participation. You have the floor. Thank you. A warm greeting for Dr. Barbosa and everyone. The Minister of Health of Peru also sends his regards. He sees this session as being very important precisely because we're going to report on what our country has been doing in response to this problem, a problem as serious as is the tuberculosis matter. I'm going to put my presentation up on the screen. Tell me if you can see it well. Yes. Thank you very much. In our country, tuberculosis well, this presentation is going to allow me to zero in on and speak succinctly about the current situation of tuberculosis in Peru. We'd like to talk about international recommendations and the different treatments developed over the last couple of years. The population of Peru has 34 million inhabitants nearly, with a morbidity rate of 32,769 as of last year. You can see the stats for incidence and relapse, abandoning of treatment, broken down by the different groups, multi-resistant tuberculosis. is a problem we also have. We have much to do to close this gap. Peru is among the 3 countries with the greatest burden in the Americas, greatest burden of tuberculosis, precisely given this urgent need to move toward, to find a evidence-based, sustainable, and effective approach to tuberculosis. You can see what we've done over the last couple of years. What we've been developing now. If you look up on the slide, you'll see a good proportion of those affected by multi-resistant tuberculosis, and extremely resistant tuberculosis is in the capital. That's where the greatest concentration is. Multi-drug resistant TB there's a upward trend over the last couple of years in the capital, and what we're doing right now, we will describe. We are updating our technical norms for tuberculosis treatment. Very important innovations have been brought to bear. Over the last couple of years, shortened treatment. We already implemented such treatment with the assistance of cooperating agencies, which is helping us to achieve higher levels of adherence. The technical norm is about to be wrapped up. It's pending approval for us to make it available to the healthcare teams with the different treatment regimes. The Health Ministry has stressed the importance of securing financing for this strategy. We have the 2024 draft budget, for which more than 723 million sols, the Peruvian currency, will be allocated to combat tuberculosis and HIV, and also offer nutritional support for patients with tuberculosis and to expand coverage. The issue of making use of innovative techniques for diagnosis, such as molecular tests, enabling us to not only be more precise in our diagnosis capability, but also at the first level of care, it makes it possible for us to bring these testing techniques to the most vulnerable people. October of last year, Peru rolled out some of these capabilities in 30 labs of reference, enhancing the operation of these labs, 30 labs, that are now capable of conducting molecular tests in 25 different regions, 3 institutes, and 2 hospitals to rule out first and second line resistant, TB-resistant strains in our country. Furthermore, this is a very important technology that we have brought to bear in the regions of high incidence in 6 different regions with these or molecular tests and equipment to conduct these molecular tests, and digital X-ray, as well as AI. We're just starting to roll out this technology so that we can close the gap and which we are moving toward closing that gap so we can reduce the burden of this disease. We have more than 297,000 people who have been screened for tuberculosis and multi-drug resistant tuberculosis in the capital, Lima.
The Global Fund has supported us with 166,000. This is a very important fund, and it will also be supported by complementary budget coming from our country's budget. Decentralization using molecular biology equipment will continue to expand. Not only are we going to increase our response of reference labs, but also we will establish health reform so as to increase the number to 1 million people scanned. And that will be 26 million soles for molecular testing, for screening, and for equipment for radiology, digital radiology assisted by artificial intelligence. And this is definitely going to be a very important step forward to assure the decentralization and improvement of detection of patients so as to provide timely treatment. There is also a need to close the gap of case detection in vulnerable populations. All of this includes vulnerable populations. We talked about the population deprived of liberty. We also are talking about 60,000 people that are deprived of liberty, being scanned, being screened for prioritized regions. Those are the regions where the pathology is at the highest levels. And we have already mapped budget, and that will be implemented as an additional requirement for later years so as to provide permanent and continuous scaling up so as to be able to assure effective work being done in this area. Now, that is going to be complemented with interventions in schools, training institutions. Also, we will be intervening in hotspots, in areas of risk. And also, we want to reach those areas where we will detect more cases. Now, the implementation of these shortened treatments, oral treatment, is something that we are doing here in the country, and this is going to use oral treatments at fixed doses, and this will be able to improve compliance and all of the results. As I said, all of these treatments have been considered, and they are something that we're working on continuously. We are doing active management to assure sustainability and availability of all the necessary pharmaceutical products. We estimated 34 million in the budget for the country, plus another 5 million soles to complement what is being done to assure results. Now, also, we are considering some technological innovations that have been foreseen to tackle different aspects of the problem. One of the problems that affects populations being treated, TV populations, is the mental health problems, and that can even endanger the continuity of treatment. People may not continue their treatment and be successful with it because of mental health problems. So we are working on this. We are doing validation with the Ministry of Health's technical sector. So we are trying to identify and do screening using a survey that could be done over the cell phone to detect mental health problems that could put at risk not only the general health of the patient, but also can endanger the continuity of treatment. And that way, these people could be referred to a community healthcare service. That is something that the Ministry of Health has been implementing recently. There we have coordination with the Executive Directorate of Mental Health in the Ministry of Health. And in this way, we want the patients to receive additional support from the mental health standpoint. And that will allow us to get information on an ongoing basis so that we can perhaps provide additional mental health interventions that will improve our intervention and its results. Dotline is an app, and in that way, we can do observed treatment of these therapies by using this app. It's another innovation that has allowed us to optimize resources. Often, first-level health services have a tremendous workload. They're often overloaded. And with an app like this, we can improve adherence and also the continuity of treatment in this target population. Another thing is we have a second version of our SIS-TV. That's an information system. And what is it it's after? It wants to assure interoperability. Now, I'm sure that this is not the only country that has to deal with this issue, but information systems in most of our countries is fragmented. And in order to deal with that flaw in our system, we are updating our information system for tuberculosis. So it will be more interoperable with all the systems you can see at the bottom of the slide. These other systems have relevant information in terms of good management. So we need to access that data. So having a system of that nature, we will be able to make better decisions based on better quality data. Coordinating our work with different organizations that support people treated within the framework of mental health, the active search. There we are doing coordinated work with these organizations, and they are very important to us, and they definitely will bring additional benefits. So also we have to update our management using healthcare professionals. We have people that are being trained in the healthcare sector across the regions. So different occupational groups in the country are being trained. So the work done on screening, timely treatment, has a lot to do with using these new technologies. We are moving ahead with AI-assisted radiology, and that is going to allow us to have an algorithm that we've already mapped. It will allow us to improve the timeliness of detection, and that means also improving the timely treatment of these patients. That this is well documented. It is moving ahead. We're working with healthcare professionals across the entire country, placing great emphasis on working in the healthcare establishments in vulnerable populations. We have different guidelines for management in the sector, and that aims at not only improving the first level of care, but also assuring mobile operations that improve the health of these populations. Often there are problems with access for geographic reasons. Also, we have mobile platforms not only to do detection, but also to do preventive treatment for tuberculosis with identification of contacts in the population, and that population can benefit from this management. Now, the active search for the disease in persons deprived of liberty This is some of the data. As I said, these new technologies are being implemented here in our country. So these are the results on patients where we have done active search in prisons. You can see the number of people living in prisons, also the prison visitors, and the population living around prisons that have been screened. So these are just initial results. But what we're trying to do now is provide sustainability to this effort so that it can be scaled up. In addition to that, we're making certain that the subnational levels with interagency, intersectoral coordination will have the capability of managing these programs at the subnational level. So these components have been developed, as you can see here. You can see where this has been done in Lima, Callao, other subsectors. We know that our healthcare systems usually tend to be fragmented, and that is something we have to deal with. But with this intersectoral and subnational efforts, we have paid close attention to management. And here we had a meeting of managers of TB programs to assure close coordination. In addition to that, we have very good relations and we have support from our legislature. Here you can see the parliamentarians that are part of this parliamentarian front for tuberculosis, and they have approved specific laws that are now being implemented, and they also are constantly being updated. This is the law from 2014, 2016, and under the leadership of the legislature, they are being implemented, and with their support, we have had a greater impact in other areas of our work in the country. Here we had a visit from the World Health Organization. It was a great visit, and it did give us the opportunity to present the work that we've been doing. And we realize that this not only makes it possible to show our progress, but also it allows us to speak of our constraints and what we have to do. So the intersectoral coordination with many different agencies and institutions, all of this leads us to realize where we have to focus our efforts and also detect areas for improvement, specific objectives for focused interventions. Here you can see multiple drug resistance, TB, and the additional demands that we're going to be dealing with this year with the 50 million, and then in subsequent years. Here you can see what we need. And this goes to the executive branch of government, the senior levels, so that we will be given these resources that we need as we work towards the elimination, which is our goal. Now, the country has accepted the recommendations of these consolidated guidelines. We are expanding the use of these new technologies, the use of rapid molecular tests, also the possibility of detecting first and second line resistance, also increasing our ability to do radiological detection with AI. These two technologies are being implemented here in the country, but they're being scaled up. And for the first time, technologies like the possibility of dealing with children, combined systems, also the shortened oral cycles that began to be implemented in October. They too are being scaled up. Then preventive treatment for tuberculosis, that too has been mentioned, focusing interventions on vulnerable populations. We have mapped them already, and we are looking for ways to improve the management of this at the subnational level, implementing information systems and the interoperability with other systems, also coordinated work with other sectors, and at different levels of government and assuring the participation of the organized civil society. So as we do a self or cross coordination, that is going to allow us to assure the success that we all seek. So fighting tuberculosis, prevent, detect, and take action. That is our slogan when we meet with our key populations. So thank you very much. Thank you for your attention. Here you can see a picture of the most recent event. This is the logo, and it came from a very recent event. Thank you very much, Mr. Vice Minister, Dr. Eric Ricardo Peña. That was an excellent presentation. I congratulate you on the progress you have made and the ambitious plans. The country is truly one of the pioneers in the implementation of these technologies and these key innovations that support active search and using the digital solutions so as to strengthen adherence. Also, I wanted to emphasize what you said about strengthening planning at the subnational and local level with the view to strengthening the first level of care. That is something that Dr. Ethel also mentioned. Now, this progress in Peru, and Peru is one of the countries with a high load of drug-resistant tuberculosis. Hopefully, that information will be of use to other countries. So we hope to be able to work closely with you and with Dr. Alarcon, who is with us today. So thank you very much. Now, we're going to watch a video on Peru's experience. This is something that the Vice Minister did mention, talking about active search using digital radiology. And also we'll see another video having to do with Paraguay's experience. We said that these are tools that can help accelerate our response to TB, helping us find the people with TB that may have gone undetected. So Juan David, can we see Peru's video? To find these people, we have to intensify active search, giving priority to persons in situations of vulnerability. PAHO recommends the use of chest x-rays to do an active search of tuberculosis. CAD makes this possible. The technology has been a useful tool. Peru has been a pioneer in the use of this technology and continues to expand its implementation. CAD is used in prisons along with rapid diagnosis tests. This has increased detection in the prison population. Health promoters in prisons support the active search for people with tuberculosis. This places Peru as a benchmark country. Tuberculosis can be prevented and cured. With collective action, we can put an end to tuberculosis.
Muchas gracias. Agradecer a
I thank the Ministry of Peru for that video showing the very important work that's being done in prisons with this vulnerable population. We also have another video from Paraguay that shows how the national Paraguayan program is also making use of these initiatives to assist vulnerable populations, indigenous populations, incarcerated populations as well. The active search for tuberculosis in Paraguay now, with the 8 prior methods, we have had technical problems with the diagnosis. Now we're using mobile X-ray machines, making it possible for us to test a number of people. This used along with a computer that enables us to quickly see what's happening. I think this is the most important thing. We see these preliminary results as being quite hopeful, encouraging. Now, if we had to recommend an early detection strategy in a country with similar characteristics as ours, this would be the best option. Now we're implementing digital X-ray for screening and the reading of these X-rays by computer, making use of artificial intelligence, which collaborates in those diagnoses conducted by X-ray, which gives us a clear idea of whether someone has or does not have tuberculosis. This has helped us a lot in 2022 among indigenous communities, in the incarcerated population, as well as in the poorer outskirts of the capital city. The digital X-ray system has helped us a lot with screening of active cases of tuberculosis. We have also made use of this among indigenous populations and incarcerated populations, enabling us to diagnose 63 different cases using this methodology. Through radio X-ray, we diagnosed 300 cases, also assisted by artificial intelligence. Now, it's really hard for a lot of people to reach a healthcare center, and so it's very important that early diagnosis can be conducted in the communities, taken to the communities to assist the most vulnerable populations. And these digital X-ray methodologies assisted by AI that can be used in people's homes have really been helpful. We need to have a vehicle that's capable of traversing difficult landscapes, muddy roads. So that's why it's very important for us to have the necessary tools with us, shovels and so forth, so that we can dig out when we get bogged down in the mud and move on. We have more than 70 indigenous communities, and the furthest one away is 170 kilometers away. Now, for them to come to a specialized center for consultation, it's very difficult. That's why we have implemented the AI-assisted digital X-ray, taking them to the community, making it easier for the communities to be diagnosed, especially when you take into account the economic straits these communities find themselves in. I have come to San Cayetano to follow through with my treatment. I feel quite well. I'm very happy with them and how they've helped me. If I get sick, they give me the medicines I need, as well as the food I need. I don't have words to thank you. I have been following through with my treatment there. I really don't know how to thank you. Anyone who has a productive cough should come and to their doctor's visit. I was afraid, but I followed through on my treatment, and with the support of the health ministry and in the city of San Cayetano, I received the treatment I needed. I've been cured. Thanks be to God. Thank you. I thank the Ministry of Health of Paraguay and for sharing those videos with us, in which we see how these tools can assist these vulnerable populations. These tools are very easy to use under such difficult to reach or in difficult circumstances in difficult to reach societies or communities at the first level of care. All of this material, the videos and so forth, will be put up on our webpage as well as made available via our social network channels. We have more than 650 people connected, and we have the TB Situation Room that's also been put up on our webpage. It's an active dashboard that enables us to stay abreast of the data that we have on tuberculosis in the region. Now, moving on, I would like to invite Karen Rivas, who is a representative of civil society, Tuberculosis Civil Society Organization in Colombia, in Antioquia, as well as in Medellin, offering support to those who have TB. She's also a member of another TB organization that's a partner organization with PAHO. So I'll give you the floor, Karen Rivas. Good morning, everyone. I'm happy to be here. I thank Dr. Peña from the regional team of PAHO and all the members of his team. I just want to greet everyone. It would take too much time if I were to name everyone. And I also thank the 650 people who are listening in, some of whom send me WhatsApp messages encouraging me to be here. Now, it's a pleasure for me to be a spokesperson on behalf of the people that we support. And in the region of the Americas, we are a civil organization that has made great strides to work with countries to empower other organizations such that we can work together. As Dr. Alonso said, there needs to be civil society involvement. We need to involve the people who are also affected by tuberculosis and to expand community services so that we can bring about changes to further assist people who are receiving treatment. Nelson Mandela said we should be mindful of the fact that it's always the right time to do the right thing. We have to be strategic and make best use of our time in fighting tuberculosis. This is the right time for us to change our outlook, our perspective, and to do things better than we have thus far. The region is seeking to eliminate this disease and others, and that all comes down to our ability to join together as a chain, as a group, and to bring to bear these new technologies and treatment schemes that we've been talking about. As Pedro Avedillo said, if someone has a drug-resistant tuberculosis who has received treatment for 4 years, well, I actually was sick for 4 years with TB. When I took the cocktail of medicines, it was very difficult to have to apply my own injection for a year, a long year, to take all of the different pills I had to take, to fast sometimes. And so the hardest thing was to fight against people's indifference and to have to cope with deficient services. Sometimes I had to go to the different stores in the markets to buy the products that weren't available to me elsewhere. Beef, for example, or meat that I needed to supplement my diet. But all of these difficulties helped me understand that I needed to become a community leader after recovering from TB. And thanks to the support that so many of you offered me directly, I now am an agent for change to assist people who have TB. Now, the Bolivarian Clinic was founded in 2018. We identified a cohort, a team of doctors, social workers, specialists, psychiatrists. So we put together a group. There were people who had been in treatment for 7 years, some people whose rights had been violated, who had been misunderstood. We first sought to understand them. And so we had started with a 28% recovery rate. Within a year and a half, we reached nearly 70% recovery rate. Now, what's really sad, just as when I was receiving treatment, many of my friends died. Some were affected by the medicines, left deaf. And in that cohort, there were people who were receiving undesirable treatments. We brought together all the different services that are available in a holistic way so that people, so we created a one-stop shopping, single window type of clinic whereby people could arrive and do all of the treatments or diagnoses that needed to be done. It may have taken 3 hours, but it was in one location, making it easier for them. Again, some people, given the treatment, lost some of their hearing. Some of them had nuclear transplants, cochlear transplants rather, to enhance their hearing. Different treatment schemes are now being implemented that reduce the negative side effects, and this brings them much hope. They're not having to deal with so many adverse secondary effects of the medication. And these are people who were made happy by this change in approach, who went back to work, who had more hope. And then we got more and more community involvement. And that's key. We all need to keep in mind that the community plays a very important role for us to achieve the objectives we set out for ourselves. Healthcare services, with the implementation of these new treatment regimes that are shorter, making use of these new technologies for diagnosis, enabling us to take this treatment to all the different areas, sectors, with the assistance of the community. Working together, we have or are reaching the goals we set out for ourselves. Working with all aspects of civil society, we need to continue to advocate for this, to meet the demand for these services, to speed up the innovation of new treatments, and to further get out this message, bringing together all these different sectors, and just to let it be known that we are meeting our goals. We need to empower ourselves, and in our minds, we have to understand that definitive changes can be brought about in the region as we move toward elimination of tuberculosis. I would also like to stress
I also wanted to make mention of those people who opened up paths for us to follow, because those people were truly trailblazers in this process. They gave us the possibility of accomplishing everything that we have achieved. So we have to continue to see people that have TB as persons with dignity. We have to restore their right to health, and we also have to support the whole treatment process. It is important, in my mind, for us to go back and realize that all of the people who died should have had a different outcome. We didn't have enough time with them, but there are thousands of people that still are in time to profit from a cure or from the recovery of their rights. Also, as Dr. Peña was saying, we have to assure food security for these people. We have to provide means to make certain that social protection will be provided in the countries. This may not be established under the tuberculosis laws, but these people often come from vulnerable populations, and they are entitled to access to the social protection services the country provides. I have always said this from the time when I was a patient. Tuberculosis is not a disease of the poor, but it does affect the most vulnerable populations. And that is why catastrophe costs are so high. So I wanted to thank all of you, and I hope that we will be able to continue to report on significant changes as the years go by. I thank you very much for your recognizing the work done by civil society and the communities. Thank you very much. I thank you, Karen, for your words and for the work that you do. Thank you for sharing that experience and speaking in the first person. You showed us how important community participation is working with those affected by the disease. So we are convinced that the work with civil society and with all the players involved, you mentioned the laws, other important factors have been mentioned, things like the parliamentarians, our colleagues on the parliamentarian front of the Americas. So there too, that's another joint effort that aims at making certain that persons and communities are at the center of our response. Thank you, Karin. Okay, we are getting close to the end of our event. We're a bit over time.
We would like to close this event with the intervention of the Assistant Director of the Pan American Health Organization, Dr. Rhonda Seeley Thomas, who will present the conclusions and the closing remarks. So thank you so much, Dr. Seeley Thomas, for being here with us, and please, the floor is yours. Thank you.
Thank you, Dr. Avedito. Buenas tardes to everyone. Good afternoon. I want to recognize Dr. Eartha Maciel, Secretary of the Environment and Health Surveillance in Brazil, Dr. Eric Ricardo Peña Sanchez, Vice Minister of Public Health, Ministry of Health, Peru, Ms. Karen Rivas, member of the Colombian Anti-TB League, and of course, Dr. Javas Barbosa, our Director of the Pan American Health Organization. Esteemed colleagues, including the over 600 participants that we have online. Let me begin by thanking all of the presenters in this high-level event organized for World Tuberculosis Day 2024. As Dr. Javas Barbosa, our director, would have stated in his welcome remarks, the Americas is in a unique position to become the first region in the world to achieve TB elimination. As highlighted by Dr. Monica Alonso, Unit Chief for HIV, STI, Viral Hepatitis, and TB here at PAHO, in 2022, 14 countries of our region achieved low TB incidence levels, many of them in the Caribbean sub-region. Some countries are reaching the threshold of pre-elimination and elimination of TB. This could spearhead our efforts to make our region the first in the world to achieve this important goal. As was also mentioned today, to achieve the elimination of TB, more investments are needed to support the rollout of evidence-based technologies and innovations, such as more sensitive and cost-effective tools for screening, simplified TB preventive treatments, rapid molecular diagnostics, and shorter treatment regimes. Existing technologies have proven effective, and we have to take advantage of these, while other tools, such as an effective TB vaccine and more efficient TB prevention and treatment tools are being developed. Last week, the World Health Organization released an investment case for TB screening and preventive treatment that was developed with 4 countries, including Brazil. It showed that the implementation of TB screening and preventive treatment can substantially reduce TB incidence and mortality. This investment case also showed that even modest investments in TB can lead to significant health and economic benefits. In addition, we know that comprehensive multi-sectoral approaches, including the meaningful engagement of the community, are essential in our efforts to eliminate TB. This was highlighted by almost all of our presenters, but mostly by our last presenter, Ms. Karen Rivas of Colombia, who emphasized the importance and powerful perspectives of community and people directly affected by TB. Ms. Rivas also underscored the critical need to involve them in the response to ensure an effective, person-centered services. The interventions from today's events also serve to remind us that as a region in the Americas, we still face important challenges to reach the targets of the End TB strategy, as well as the new targets that were agreed by heads of state at the 2023 United Nations High-Level Meeting on TB. However, we have also learned today about promising examples in countries such as Brazil, with its CIE, DDS, and Healthy Brazil programs that are committed to eliminating TB and to implementing innovations to accelerate their efforts. We have also heard from Peru about their innovations, including the mental health component of its tuberculosis program, its app, the Dot Line, that optimizes resources, and the update of its TB section of its health information system. AI-assisted technology is also another promising tool that can assist our move to TB elimination. PAHO continues to work with its member states through its Elimination Initiative to put equity at the forefront of our TB response and to accelerate the implementation of innovative interventions with a focus on strengthening primary healthcare and integrating services to achieve universal health. PAHO also supports various mechanisms that provide technical cooperation, such as the Green Light Committee and other regional groups of experts, such as the Network of Supranational Laboratories for TB and the collaborating centers in Argentina and Cuba. In addition, the PAHO Strategic Fund is an invaluable regional mechanism to support member states in improving access to affordable and quality-assured essential medicines and strategic health supplies. Finally, I would like to emphasize the need for a multi-sectoral approach for the implementation of these activities that addresses the social determinants of health and includes the active participation of the community and those affected by TB, as was highlighted by all of our presenters, in order to leave no one behind. Ladies and gentlemen, in conclusion, again, thanks to all our presenters, and please be reminded that it's time to act. It's time to end TB, because yes, together we can end TB. Thank you.
Thank you very much, Assistant Director, Dr. Silly Thomas, for your inspiring words. And with this, we will conclude this event of the World TB Day. And I would like to thank also panelists, Dr. Barbosa, Dr. Alonso, health authorities, Dr. Maciel, Dr. Peña, Karen Rivas, and Dr. Silly Thomas. Thank you all for being here today with us. Agradecer también a los traductores, por supuesto a todo el equipo de OPS que ha estado detrás de cámaras, al equipo de comunicación y en especial al equipo de tuberculosis de OPS.
I wanted to also thank the interpreters, the technicians, and I thank Julia Castillo for her efforts. So I hope that you enjoyed the event, and I hope that this message of joint commitment will prevail all year, not only for the World Tuberculosis Day. This should reinforce our commitment to work together, accelerate our response to ensure that the Americas will be the first region to eliminate tuberculosis. So thank you, and I hope you have a very good day.